best sex positions in order to conceive? So again, this is a subject that I get lots of questions about, and again, there are lots of myths and theories circulating out there. So I'm going to talk in terms of what's been suggested and what's actually been proven. So first thing to say is there is no particular position that's been proven to be the best. There are lots of theories as to what these particular positions should be, and one of the commonest is the missionary position, simply because it's believed that this is the way that the sperm will reach the cervix the fastest route, and also in terms of how close that level of penetration will be in reaching the cervix and exposing all of the sperm to the reproductive tract in the woman. Sometimes it's said that perhaps you should put a pillow underneath the woman's pelvis in order to help thrust her pelvis forward and to change the angle of the cervix again, so that when penetration occurs, the actual sperm can reach the cervix faster. However, none of this has really been proven. One of the things, however, that studies have been done on is whether there should be a period of rest after sex, and whether this is beneficial in any way in terms of achieving fertilization and conception. So people have looked at intrauterine insemination and pregnancy rates following on from that, with a period of rest of around 15 minutes that's encouraged after the actual intrauterine insemination is done. And it has been shown in some of the studies that actually this can make a positive difference to the fertilization rate. So if after you have sex you choose to rest for a short period of time, then this is something that should actually probably be encouraged if we choose to believe these studies. And it's one of the other reasons why people believe that female orgasm may in fact be quite important in terms of, again, achieving fertilization or conception. So one of the theories is that with female orgasm, what happens is there's a suction effect that occurs with the sperm getting propelled into the vagina and then into the uterus and eventually into the reproductive tract, and that this process is encouraged by uterine contractions that occur following on from female orgasm. It's also believed that if a man orgasms, then he's able to release more sperm into the vagina, which essentially will give a greater number of sperm and a greater statistical chance of fertilization occurring. Another reason why orgasm is believed to be important is for the same reason that I mentioned that rest might be important after sex, and that's because after an orgasm both the man and woman tend to want to rest afterwards, and this may be because potentially this period of rest could influence success rate, though again not strictly proven to be true. And you've got to bear in mind that actually one of the things that people believe with orgasm is that, ancestrally speaking, orgasm used to be important in terms of achieving ovulation in certain animals. And there are certain animals where that, in fact, is still true. But humans aren't one of them, because humans are obviously capable of ovulating without orgasm. So whether or not you have orgasm essentially doesn't really matter. Yes, it's beneficial in terms of your experience of pleasure and desire during the act of sex, and yes, potentially it may help to influence fertilization rate, but none of it is proven. And what you shouldn't get bogged down on is the sort of pressure we'll need to have an orgasm, because it's perfectly possible to conceive without sex, no matter what sex position you choose to adapt.